Hi there, Taylor Cowell with Texas Panhandle Centers. And today I'm joined with Lindsay Garza with the Early Childhood Intervention Program. And so thank you for joining us today. Let's talk a little bit about your program, who y'all serve, and kind of the purpose of y'all's program for TPC.
Okay, so we serve children in Potter and Randall County. We serve children from birth to 3 years of age. And within our services, we provide physical therapy, occupational therapy, speech therapy. We also have a licensed professional counselor who provides family counseling. We have nutrition services available, and then through the local school districts, we can provide auditory impairment services and vision impairment.
Wow.
For any children that have those needs.
So really the whole, covering every aspect of physical and mental health when it comes to these early childhood or early.
And I did forget one of our most important, but we have early intervention specialists who provide specialized skills training and the case management needs.
Oh, wow.
For all of the families that are on their caseloads.
That's awesome. So you're working with the child and the family through all this. Yeah. And we were kind of talking a little bit earlier about how a lot of this is focused on improving the relationship between the child and the parent, or changing behaviors, right? And so what does it look like, on a day-to-day basis when you're working with a family and a child?
So whenever we go out to the family's home and determine if they qualify or not, we're really working with a family to figure out what is a day in a life like for your child, what are daily routines, what are things that they're really doing well, what are some areas that you would like some help, and then from that, developing the plan, we come up with the goals. So we really have our families involved. What would you like them to do? How will we know that this goal has been obtained? And then from that, we determine the services that we're getting. So from the beginning, we're really trying to start working on empowering the family to figure out what it is that we could help them with. So then whenever we come in, we review the goals, see how they've been doing. And then we use a coaching model so that we can kind of ask mom, hey, what's been working, what has been really challenging, and then what can we work on? So as we're giving those strategies to the family, we want them to kind of demonstrate it, because the parent is with the child 24/7. So sometimes we use the phrase that we're empowering the parent to be their child's therapist, because the therapist may be there for 1 hour a week, but us being there for that 1 hour a week isn't going to make a difference. So the parent is there to continue to reinforce and re-implement the strategy, and then we modify at the next visit.
Yeah, and keep practicing those. That way, whatever issue that child is having, it's getting better constantly. And you just kind of come in there, or you and everyone at ECI is coming there to constantly help improve it as best as it can, right? So you mentioned earlier that people in this program are there from, or children, I should say, are there from 0 to 2, right?
0 to 3.
0 to 3.
And then at about 2.5 months, we start working on a plan for transitioning them out of ECI.
So what does that really look like? So, they come through this program, maybe they're in there for a year or two, and then they start to transition. Where do they transition afterwards?
So whenever we do our first transition meeting, which we really try to do it at 27 months, normally it's between 27 and 30 months, but we talk to them about their options. If they would like a referral to the local school district to have them evaluated to see if they qualify for the preschool program at the school, if they would like Head Start, and then if the parent denies, or they can opt out of the school services, and then if they do that, we'll give them a list. We have a resource handout that includes other Texas Panhandle Centers programs like FAYS and the Children's Behavioral Health, and then any other community resources, so private therapy or other in-home therapy that sees children after 3.
Right. So you're really trying to kind of utilize all of as many community resources as you can to help kind of supplement this process that the family and the child is going through a lot.
Yes.
Yeah. I think that's super important for anyone, because as providers, sometimes we can only see them once a week, maybe not even that much, sometimes once every 2 weeks or once a month. And so when you have all these resources around them to help kind of build this child and this family up, I think that's super helpful. So for you, what's your favorite part about working with
What is my favorite part? My favorite part is whenever you're in a home and you just get that connection with the parent and the child. And whenever you've been, there are some times that we start seeing a baby whenever they're fresh out of the hospital. So
Oh,
you
wow.
build this bond and this connection, and you're just part of that. You kind of sometimes feel like you're part of the family for a really long time.
The parents begin to trust you a lot.
Yes,
Yeah.
yes, for all of those years. And
Mhm.
and it's neat too whenever we're out in the community at events and someone stops by and they're like, hey,
Oh
so
my
and
gosh,
so
yeah.
was my ECI therapist, 10 years ago. Or
Mhm.
if I am just somewhere locally that someone knows me and they know that I work for ECI.
Yeah.
So that's really cool to see that connection that's made.
Right. And I think, especially with working with them at such a young age, you really are preventing things from getting worse later down the line, to where these people are hopefully not having to be in a system, or whether that's later down the line and they're in jail, or they're having other mental health issues or something like that. And so I think that's really important for people to know, is that this probably does prevent further worse circumstances.
Right.
Well, I think that is just lovely. And I think we all appreciate you, and it was really great getting to learn a lot about this program today. But anyways, so our crisis hotline number is 806-359-6699. Thank you.